here, the bronchus and this in. B are those bones. C is the heart. D is the diaphragm. And E stands for anything that is extra. I will get to show you pictures now. Extra in this that it is. So this is how we have started our journey. We took around 15-20 minutes into this, and this completes the story. Now, if you have understood up to this that I am trying to describe all X-rays into A, B, C, D, E, then if I'm trying to describe everything as A for ear, B for bones, C for cardiac, D for the diaphragm, and E for extra things that you could see. And if you remember this one, remember that I am a surgeon who is teaching you, and in a surgery exam, it just takes, believe me, 5 seconds to orient your eyes to look into that. Say, for example, let us get into knowing into this X-ray. Okay, let us start by showing you this one, which, as I have said, is a normal X-ray. So, as I've said, this kind of an X-ray is a normal X-ray. So, give me a minute, please. Yes. So, this, guys, is normal. I could not see, and I've taught you this one. Now, if this is normal, then tell me, okay, if this is a normal X-ray, then tell me what is bad in this one. In this picture, tell me what is wrong in which component has something that is bad. Again, what is the principle that I've taught you? The principle that I've taught you is something called as A. Okay, in this one, what is the bad thing about the A that you can see? You can see something, isn't it? Okay, what is that one? Sir, this is the blackness in the lungs. This is normal. But again, I can see many things that are white. Why is it white? What did I teach you now? Sir, I taught you that this is blood, okay, or fluid. So it depends upon the scenario, but definitely this is not normal. So that means if you remember this one, that if this is the lung and this is the blood, that means this patient must have had something really bad, okay? And if this is A, oh, by the way, I really forgot. What is the thing that I forgot? Yes, this tube. What is this tube that I'm trying to show you? Is something that is called as the trachea. Is the trachea central in location? Let me see then. Well. Clavicle, this clavicle. Can you appreciate that this pipe or the trachea very beautifully is more on the right side than the left side? Why do you think this has happened? Because something on the left has pushed the trachea and the mediastinum to the other side. So that means there is some mediastinal. That means this picture shows you that there is a mediastinal displacement. So this is something that you are required to understand. And that means the pathology is serious enough. You need to do something very rapidly, very fast. Now, so A done. What about B? Well, not a good quality X-ray, sir, but I can not understand. Are the bones intact? I am really confused, because for knowing bones, I need to see the upper border, lower border. I'm not very sure whether the bones are intact, but what I can think over is that maybe, a big maybe, there is a fracture. I'm not very sure. I need another X-ray, maybe a better one. But the quality is that maybe there is a fracture and I'm not at all very sure of it. But definitely the pathology is on that side. The she or the cardiac shadow is still seen. Okay, you can see that the cardiac shadow is still seen. I'm not asking all those medicine questions, which border is made by which. But what is important is this distance is, as I have said, is y. And what is the other distance? The other distance is x. What is y? Sir, y is less than half of x. Now, if you have not understood what is x and y, kindly have a look again. It doesn't appear that bad. But yes, it doesn't appear to have at least a big globular shape, something that I will show you immediately after this. So this is C. What about the D then? The D is the diaphragm, as I've said. The most important problem in this one is I cannot count the diaphragm, but one important thing that has happened is on the right side, the diaphragm should have been convex. Convex. I cannot see that because this angle, so-called as costophrenic angles, as you can see, are not seen. Now, the costophrenic angles are not seen like this one. Very obviously, there must have been something in this angle, which, as you can see in this picture, has been filled up with something, and in an accident scenario, has to be blood in the thorax. Okay, so this is something that is there. So that means this patient is probably a patient with an trauma, that means an accident, and after the trauma, what is very simplistic to remember and understand is that this chap has had a left-sided pleural collection, maybe blood. In accident, you expect blood to come out. And on the right side, yes, there is, so probably blood. But what is more dangerous for this patient is that the left-sided problem is compressing upon the mediastinum. So if you have understood up to this is good enough. We are not talking, I'm not teaching you chest trauma, but after an accident, I think you can see. Extra means something what is really interesting, and you will get to know that. Like, if I can go 2 x-rays by the side. Now, let me see. Yes. Right. This one. What is the extra thing that you can get to see in this one? Everyone can see that. It looks like a mobile phone. No, it's not a mobile phone. So then what's it? So what is this? It's not a mobile phone. This one is called as a pacemaker. And as you can see, the cardiologist has put in the pipes or the wires, and this is stimulating the heart. So if you do get interesting pictures like this patient has everything normal. If you can see again very quickly, if I have made your eyes trained, this patient has everything normal except for having a pacemaker. Okay, now if you are really very interesting, sir, I have very good eyes, then maybe that the bronchi are a bit prominent, but again, we'll not stop. But A is normal. Bones, that is those B's, appear to be normal, guys. Yes, they are normal. C is the heart shadow. Yes, sir, it is normal. D is the diaphragm. Sir, it is normal. Okay, what is this one? Is stomach shadow. Okay. And what is E then? Sir, the E is the extra. So this is something. Okay. So this completes this one. Now, if you have looked into this, tell me if you have understood up to this. Now, tell me, guys, this patient sustained a blunt trauma to his chest. So he was in a kickboxing, and in this kickboxing tournament, what happened was that this man got really hit in this part. So now, if this is the nipple line, this is the umbilicus, this chap got a big kick in this area. You say, wow, man, bad area to get a kick. And after he had a kick, he fell down and had a very severe chest pain, hypotension. Now, tell me very easily, A is this. A is this. So what is the bad about A? Sir, there is nothing bad about A. Okay. Trachea is normal. Okay. Lungs are normal. A is okay. So let us put a tick on that. What about B? B is bones. Can you see any bones that are bad? Clavicles are okay. Ribs. Okay. I cannot see. Okay. So that means, nextly, if A is okay, B is okay. Let us talk about the C then, guys. If you have talked about the C, wow, man, he's a big heart. And now the C, tell me, what is the biggest problem in this C? Now, can you see that if the maximum diameter is X, what is this diameter? Wow, this is Y. And Y definitely is greater than half of X. That simply means after the kick that he received in his chest, very simply means that his heart may have been here, but surrounding the heart, there is a big cavity, and that cavity is now filled up with a condition called as pericardial tamponade. So remember, it is pericardial tamponade. So let me write it out for you. Pericardial tamponade. So remember this. So pericardial tamponade. So this is this. So if it is pericardial tamponade, the treatment for this is urgent evacuation of this blood through the subxiphoid route. So for your MCQ, please mark it. Pericardial tamponades are associated as a very favorite MCQ questions. So for an examination purpose, remember, you are given questions like that this gentleman had a chest trauma, and after he had a chest trauma, then the examiner is going to ask you, what is so special about a pericardial tamponade? He is going to ask you this one for particularly a short note. Particularly is going to ask you for an MCQ. What is very interesting is, how does a pericardial tamponade happen? Sir, by blunt trauma. Usually by blunt trauma, you don't get patients living after a stab to his heart, he dies after a blunt trauma. Now, which part of the body? Remember, that part is called as precordium, but in, that means, what is precordium? It means very easily the part of the human body that is above the heart. So this is called as precordium. Whereas on the other side, in trauma or accidents, if you read Bailey Love, okay, what is interesting is there is an area called as the box of death. You see, wow, you expected box of chocolate. I know that you are getting hungry. Okay, it's not box of chocolates, it is box of death. What is this box of death? Very easily. This is umbilicus. This is the two nipple lines. So what you do is that you make a very quickly two lines. First line passes through the nipple. So the first line is the nipple line. Okay, particularly in a male. Okay, and the next line in concern passes a finger below the xiphoid. So that means this is basically the transpyloric line, very simply. So one hand below the xiphoid. And now what you do is that make two lines through the middle of the nipple. What are they called as? Mid clavicular line. So what I will say is that I will again repeat. So I am telling you a disease condition called as pericardial tamponade. Now, pericardial tamponade in surgery, remember, if you are given an MCQ or that, remember, is more common after an accident. What type of accident? Blunt trauma. And what area? The box of death. Okay, it's not box of chocolate. Now, so there is a nipple line, there is a transpyloric line, and two lines. Now, what is interesting is this area which is bounded by that is remember that if there is someone who gets a kick or a blow or any steering wheel injury, so what we get as surgeons in our practice are usually kicks. Very common. Blows. And in automobile accidents, steering wheel injuries. So you get kicks, blows, steering wheel injuries, which are common. So what happens is after that, the heart is something like this, and the heart is enveloped by the pericardium. Remember that there is a minor tear maybe in any of the part, but that the normal pericardium contains 1 ml. If it increases greater than 50 ml in an acute setting, belly love again, remember that can be very lethal. So it is very dangerous. So remember the data. 50 ml of acute bleed is dangerous. So please understand this. Now, what is the main thing about a pericardial tamponade? What is the main thing about a pericardial tamponade? The main clinical features are: one, as you can see, the heart is not pumping blood. So there is no blood that is coming out. So that means the cardiac output is low. If the cardiac output is low, what do you think will happen to the blood pressure of the patient? Sir, is low. So the patient is in a state of a shock. What type of shock? We'll talk about that. This is called as a cardiogenic shock. Now, next part is, the next feature is, but if the heart is not pumping out blood, there is something else which is not coming in the heart also. Remember that the superior vena cava is required to bring the blood, so is the inferior vena cava, but the superior vena cava is in the draining the head neck area. So what happens is the neck veins get prominent. So the second feature is neck veins get prominent, but the pressure is low. For an MCQ, kindly remember again Bailey love stuff. This is the only condition in the whole human body, only condition of a shock where the jugular venous pressure is increased or the neck veins are distended or prominent. So neck veins are prominent or distended is this. Whereas the last one is, now as the heart is surrounded by blood and now you are trying to listen by putting a stethoscope, can you hear this? The answer is no, sir, I cannot. So that means the heart sounds are not well seen. So there is a muffled heart sound. This, remember, is the rarest presentation, but only 30% of people at all in a busy emergency will be with this sign. So that means majority don't have this one to be understood, but you are not required to know that. So there are three things that happen in a pericardial tamponade. What are those things? Number one, blood pressure is low. Okay, good one. Number two, neck veins are prominent. Number three, muffled heart sound. These three together combined is called as a triad, also called as Beck's triad. So what is it called as? It is called as Beck's triad. Okay, so remember this is called as a Beck's triad. Okay, now people add that along with the Beck's triad, you should say that this patient may have a normal air entry to the thorax with normal resonance pattern to the chest when you go for an percussion. The most important differential diagnosis, remember, is something called as a tension pneumothorax. So one day we'll have a class on blunt trauma thorax. But remember, there is something called as tension pneumothorax, which comes as a differential diagnosis. How do you differentiate between that? Sir, very simple. Remember that this diagnosis of tension is a clinical diagnosis, very simplistically. For MCQ and for Viva, the answer is very easy. In tension pneumothorax, remember, there is always T for T. The trachea must be displaced. Must means the word is must be displaced. Whereas in a pericardial tamponade, the trachea is usually central. So this is a very subtle difference, but remember, for an MCQ exam and for a Viva, this is something that you are required to remember. How do you differentiate between a tension pneumo and a trachea is central in a pericardial tamponade? Trachea is deviated in a tension pneumothorax. Now, so final part, what do you treat, or how do you treat this patient? The answer for this is that if this is the patient is in a distress, okay, remember, this is the xiphoid and this is the heart and this is the pericardium. If this is the heart with the pericardium, this is the heart with the pericardium, the only treatment that you have to do is that take a needle. The only treatment that you have to do is that take an ultrasound probe, put this into a region called as subxiphoid window, and then introduce a long needle and introduce a long needle, usually of a gauge of around 14 to 18, okay, maybe even 20, but it is good to take 14 to 18, and this needle will aspirate the blood. The needle will aspirate the blood, but remember, your guidance is always under ultrasound. So please remember that. So I have completed pericardial tamponade for all. Remember, you don't blindly poke in. You take an ultrasound probe, subxiphoid window, introduce a needle from the subxiphoid place. Now tap out the blood. So this completes the story for everything. So I've told you all things about.
Ramanuj,
Yeah.
can you go back to the amount, because there's a question, the difference between a hemopericardium and a pericardial tamponade. So where
Hemopericardium, you see, the answer for this is good one. The word tamponade comes from the French word, means for us in India, the basic simple thing is that it is dhakka dhakki or a compression. Now, compression means that if this is the pericardium and this is the heart, the term hemopericardium will mean that there is blood in this. So there is blood in the pericardial cavity. But this blood in the pericardial cavity can be very scant. Example being pericarditis, tuberculosis, etc. But medicine people will be. So that is hemopericardium. But definitely one of the causes of hemopericardium will be a trauma. But for us as surgeons, remember that this is a surgery lecture. We are interested in the blood or liquid, doesn't matter, because in an accident, you don't expect anything more to come except blood. The problem in a tamponade, as I have said, is the compression. What is compressed to make you so much afraid? Sir, the main thing that is compressed to make you afraid is only one. Remember, is the aorta, which the cardiac output will fall. That is called as a tamponade. I hope I have given you the answer. Hemopericardium is just a presence of blood in that may or may not mean a tamponade. Okay, right. So this is all about pictures that I was talking. Coming on to this one, now see this interesting picture.
Ramanuj,
ABCD. Yeah,
Ramanuj, the other question was the difference between a pericardial effusion and a
right.
pericardial tamponade. Again, I think
Again,
you
again,
made the
again,
point.
again.
You already have made the
You see,
point.
effusion. You see the word effusion anywhere in the human body: peritoneal, pericardial, pleural. The word effusion simply means accumulation of excess amount of fluid in an enclosed space. Ascites is not exactly peritoneal effusion. So it is enclosed space. The best example is pleural effusion. Now, pericardial effusion is a very common entity in cardiology, believe me. There are multiple reasons and chapters and books that are written on pericardial effusion. In India, one among the major causes is tuberculosis. But remember, the only issue is that this is a chronic state. We have seen patients up to 500 ml, even a liter of fluid in that. So remember that that is a chronic state that you are required to remember. But does this 500 ml compress the heart? If the answer is yes, then guys, you have something called as a pericardial tamponade. If it is no, it is pericardial effusion. Okay, right. So this completes the story with this. Now see this one. This patient, now very quickly, let me see if I can have my pencil, please. Yeah, okay. First of all, that this patient does not have a PA view. I think you have noted that. This is an AP view, that means anteroposterior, which was taken. Now let me see how quickly you can find out the bad things into that. So let me see if you can find out bad. Okay, the A stands for the trachea. That means A is okay. The lung shadows do not know because there appears to be something down here. So on the right side, A is not okay. There appears to be some problem of consolidation or some shadows in the A. Now, the B part is bones, and we can very simply see, wow, if you have picked it up, congratulations. If you have not, can you kindly see that this clavicle is broken? Okay, so that means the clavicle is broken down here. So wow, man, they really did not look into that. Now, along with the clavicle being broken, okay, the next other thing is that, what about ribs? Do not know, do not know. Yes, a few ribs may be broken. Yes, ribs may be broken, but we need to get better x-rays, sir. Something is wrong, but clavicle is broken, sir. What about the C then? So the C in this story is the heart. Not bad, sir. Half of that. Okay. What about the D? Well. Let us see the D. The D should have been convex, but in this patient, see the D. The D more or less is a bit convex, but there is a flattening. But what I'm really worried is that in this area, this angle appears blunted. So if you have not looked into this, have a look and then say to me whether you agree with me or not. So this area really looks a little blunted. On the left side, this is normal. But what the main intention of showing you this X-ray is, now see the extra part. Can you note that in this area, now in these areas, the normal subcutaneous tissue should have been gray in color. But in this one, can you note that there are multiple areas which are now black in the gray. That means if it is black in the gray, what do you think will be the pathology of this tissue? Remember that this then will suggest that there is air in the subcutaneous tissue. I had to take these beautiful pictures from internet, multiple sites, and I'm really grateful for the contribution. Now, so these are again multiple air pockets into these soft tissues, and this condition is called as a subcutaneous subcut and a subcutaneous surgical, or both of them are the same, emphysema. Now the word you have been taught in pathology, emphysema happens in lungs. Well, the word emphysema exactly means air containing organ which grows abnormally large. Like emphysema happens in alveoli of the lung. So their walls become thinned out. In the surgical emphysema, as you can see in this picture, you can see that yes, sir, there are multiple air pockets into this whole tissue. So that means if you combine the clavicle fracture, if you see this shadow, okay, I do not know what this shadow is. Maybe it is little bit of lung that has undergone a collapse. Maybe there is little bit of liquid in this. Okay. Let me see. I can see a fracture. Maybe yes, there is a fracture of a rib maybe, and then along with a surgical emphysema, and then at the end of the day someone is pointing out, sir, have a look, what that hell is that one? So if that is this pipe, then see that this pipe may be given by someone to take something from the air. So maybe, I am not very sure, this is a chest drain tube. So this chest drain tube is, as you can see, is taking out the air. So if you now combine all the pictures and have a new look at the picture, I have shown you all the things that you are required to see in this one. Now have a look. You can see the trachea, you can see the clavicle, you can see the lung pathologies, you can see the rib fracture, you can see surgical emphysema, you can see, oh my god, the ear has gone even up to the neck, as you can see, huge ear. And why did the air come out? Because someone had tried to put in a tube. The tube did not go in properly. So the tube did not go in properly into this. So this is the reason the tube was given. So I think that we have had a discussion onto this. Now, if this is this, another picture, if you have understood that one, now see, again, A, B, C, D, E. By this time, you know that, okay, something is very wrong. This patient has many tubes, sir, many tubes, holy God. But again, if you understand this systematically one by one, what is this tube in the center, sir? The trachea. Does the A appear okay to you? Not very okay, but yes, I can see blackness around both. Maybe that the lung has expanded, but there is something in the lungs. The B appears bones, and let me see. Yes, there are bones which are fractured. Yes, fractured. Yes, fracture. At least I can see these three fractures, sir. Maybe, yes, there is a fracture. On this side, yes, there is a fracture. Yes, there is a fracture. Okay, so B is done, is a fracture. C, well, that is something that I'm sure of, sir. The heart shadow is normal. So the C is okay. I'm happy with that. Okay, if the C is okay and you are happy with that, what about the D? Well, I'm really happy with that also. I'm happy with the D also. Okay, good. And if I'm happy with the D also, now talk about E, and then you can say that, sir, I can say multiple things. Number one, what is the first thing that you can see? Sir, air in subcutaneous tissue, air in subcutaneous tissue, air in subcutaneous tissue. So if it is air in subcutaneous tissue, what is this condition called as? Surgical or subcutaneous. What is the name that I taught you? Emphysema. So it is this. Number two. Beyond this, now can you see any more things? Yes, sir, I can see more things, and there are more tubes than I could imagine. Oh my God, so there are so many tubes. Sir, what are there? On the left, I can see that there is a tube. On the right, I can see one tube in this, another tube in this. God knows how many tubes this chap has put in. I can see multiple small lines, and these are maybe ECG leads that has been placed. So this patient was in a real bad shape, must have been in the emergency. Some people have tried to take out things from his lungs, maybe air, blood, etc. So for an exam, you are required to know what is the state. For me, very simplistically, as there are rib fractures, maybe that this patient had an history of chest trauma, Which side? Sir, both right and left. So there is bilateral trauma. Led to what? Led to maybe something in the chest called as ear in the chest. Hence this tube was given. Pneumo, or may had been blood, but I could not see any collection of fluid into this. If there was a blood, sir, I should have seen that. Okay. So this was not seen. And this is the state that examiner just wants you to note this diagnosis from this simplistic X-ray. So for an exam, particularly your NEET and your MCQs and your PLABs, this is what you are required to remember for that. Now this one, again, see this. Which side is normal and which is abnormal? Come on, guys. Very simply. By this time, your eyes are trained. A is this, isn't it? A is this. This is normal. If this is normal, then what the hell is this? And what the hell is this? Remember that this is air in the pleural cavity. So guys, if that is air, then what the hell was that blue colored thing? What the hell is this one? So this picture, that means this is a lung which has collapsed, and the lung collapse is only because you have huge amount of air. Can you show me the air in this one? Yes, I can, sir. Now see, oh my God, the whole blackness is here. So that means if you have air in the pleural cavity, how does it look like? Sir, this one is a normal air or the normal appearance. This is abnormal, and this condition in which there is air in the pleural cavity is called as pneumothorax. So I have taught you pneumothorax. What is pneumothorax? Air in the pleural cavity. So this is all about air in the pleural cavity. Now, on the other hand, now see these two pictures. You see, oh my God, again. If you have seen that here, this is again here. If that is again here, what is so bad about this here? Now again comes your ABCDE. If you are thinking about an ABCDE, then what is the state of the trachea? And where is this air? Sir, this is the air in the pleural cavity. This is the lung which has collapsed. Lung collapse. This is air. What is very important in this picture is, can you see that the air has pushed the heart to the opposite side? Air has pushed the trachea to the opposite side. So, as I have said before, what is this condition of air in the pleural cavity called as? It is called as pneumothorax. Air in the pleural cavity, pneumo is there. And if it is pneumothorax, then the next part is, this pneumothorax is not just any pneumothorax. It is associated with a big dhakka to the content in the mediastinum. The heart is shifted. So this condition is thus better called as a tension pneumothorax. So when you will have a class on chest trauma, we'll talk about that. So this is called as a tension pneumothorax. And what is so special about this image? So the more special about this image is, see the diaphragm, please. The diaphragm is this normal. On this side, can you see the diaphragm? Oh my God, the diaphragm is like this. So what is the normal appearance of the diaphragm? So the normal appearance of the diaphragm should have been a convex. What happened due to the air? The diaphragm not only became flat, in this case, the diaphragm, forget convex, it became concave. So you are given this picture and asked, what is this diagnosis? So this is a tension pneumothorax. So this is something that you are required to remember. Now see this one. Okay. Now these are not pictures that you occasionally get to see in your wards, but again, for fun, so for some interesting reasons, I had this. This is a chest X-ray, as you can see by those 4 arrows. What do you think has been the problem that someone has tried to fix? Remember that if you have gone to your orthopedics ward, this is a bone, and the bone is sometimes undergoes a fracture. And then do you know what does an orthopedic surgeon do? He uses plates and then uses small screws to fix it. Remember that. So this is exactly the thing that I wanted to show you, that rarely in your exams, a rib fracture is a very simplistic thing that if it is present, you will be getting to see that. This is something that has been done to fix a fractured rib, which is a rare thing to be done. We don't usually do this until and unless, as you will be taught again, there is a condition called as flail chest. What is a flail chest is a long question in MBBS, is a very commonly given short note, but remember, a flail chest, just for today, a flail chest for you to remember is, a flail chest for you to remember is, just remember the name of this condition, because MCQ guys will love to give you this one. The word flail chest means that by definition, there are rib number 1, rib number 2, rib number 3, and rib number 4, rib number 5, rib number 6. So rib 3, rib 4, rib 5, rib 6. Flail chest means that for a flail to happen, there has to be a fracture. For a flail to happen, there has to be a fracture of 2 ribs. Sorry. There has to be a fracture of 2 ribs, fracture number 1, and the next fracture has to be always in a consecutive rib, and this fracture is in 2 places. I will again repeat my point. Please see this and write your notes carefully. Minimum for a flail chest to happen, you need 2 ribs, 2 consecutive ribs, and 2 sides at least. So remember, there are 3 points, but 2 ribs at least. That means if this is fracture number 1, this is fracture number 2, this is fracture number 3. Will you consider this to be a flail chest? The answer is no, sir. We don't consider this to be a flail chest. So what is a flail chest, sir? Flail chest is in which, now, a flail chest is fracture number 1, fracture number 2, fracture number 3, fracture number 4. So 2 ribs, remember, 2 consecutive ribs, and 2 sides. That means if there are more than 2 sides, there is no problem. But these are the minimum criteria that you are required to remember. And then this segment, what is this area? Then this loose fragment, remember, is called as a flail. This fragment is called as a flail fragment. Okay, so that means 2 ribs, 2 consecutive ribs, 2 sides is something that you are required to remember. So I've told you more or less all things today about this one. This is something that I have taught you in the beginning, is blood or liquid, as you may say, in the pleural cavity. So I've told you this one. To end the class, I will now go to another arena, not accidents, not trauma, but a patient with a kidney lump. Now, this patient is a special one because, as I can tell you, now, rather than now, when you move from trauma, this is a patient who is a 60-year-old gentleman. The 60-year-old gentleman used to smoke his cigars and pipes very commonly. So he's a smoker, and now, as you can see, okay, he has a big belly. But in this big belly, remember that this man also complained that, doc, I am feeling something heavy on my right side, okay, and the urine that I am passing, just believe me, I got one such patient about a month ago, said that, doc, the urine is exactly like this. So what is this color of urine called as? So 60-year-old smoker urine is exactly like this. So this is something called as blood in urine, also called as hematuria. Now when you felt that, he said that, doc, you see, I have a vague pain in the loin, or technically enough, the area between the rib cage and the iliac crest. So I get a vague pain into this. And when you palpate it, you find that, oh my God, the kidney is palpable, not only palpable, it looks big, okay? The surface is irregular and the consistency is hard. Now, so surface is irregular and consistency is hard, and then that makes you think that, oh my God, what the hell do I have with me now? So remember that if you get this, this is an MCQ, this is a long question, this is a viva, this is a very common specimen, but more importantly in the MCQ world, this is this. This triad that you have seen of blood in urine, 1, a loin pain, 2, and a palpable kidney lump is a classic feature of something called as a renal cell cancer. Now, we'll not talk about renal cell cancer today, but interestingly enough, this patient went in for an X-ray of the chest. We'll not talk about renal cell cancer today, but when you did an X-ray of the chest, interestingly, you got a beautiful image. And this beautiful image that is on your screens now is this patient. Now, with your knowledge in pathology and with the ABCDE that I have taught you today, which component in the ABCDE is wrong in this one? A, B, C, D, E. Which one do you think is wrong in this one? Sir, A is wrong. B is bones, okay. C is thick. D is okay. E is okay. That means, what is so bad about the A thing that I can look? So the only thing that I can look is that I can find multiple opacities, okay, and each of these multiple opacities that you can see, I can see, oh my God, multiple opacities in that. So I can really need to count out now. So if I can get to see this multiple opacities, what are these multiple opacities called as? Remember that again, a very common viva question and an MCQ one. This picture that I've shown you is a classic telltale sign of something called as a Cannonball opacity. So this one is something called as a Cannonball opacity. Now, what do you mean by a cannon? A cannon is a command. Okay, so previously they did not have those anti-aircraft guns, so that big. And this cannons, so this is a cannonball, and these cannonballs were goal, spherical. So you could have to fire, boom. So this is a cannonball. Now that means if you had a chest X-ray with a cannonball opacities, that means if this is a chest, remember that this is how exactly a cannonball opacity looks like. Examiners will ask you in both MCQ and in your viva, what are the common causes of this? The first one, remember always, is a renal cell cancer. Why? Because a renal cell cancer very easily and very quickly, what it does is that it starts as a tumor in one pole, usually the upper pole rather than the mid. And when it starts into that, what it does is that it invades a vein And which vein are you talking about? So we're talking about inferior vena cava and the renal vein. And then what happens is it invades, so this tumor grows into the renal vein, and wonder of wonders, it comes out into a big tumor embolus. So what is the reason? Tumor embolus. And the tumor embolus comes out to the heart, the pulmonary arteries, and wow, man, you had that beautiful shadows. So these are things that you are required to remember is renal cell cancer. Examiners will ask you, beyond the renal cell cancer, do you know of any other tumors which are common? Remember guys, very easy. In males, beyond the renal cell cancer, always think of testicular tumor. In females, remember, okay, then always remember, think about either a choriocarcinoma or a endometrial carcinoma. So choriocarcinoma is an endometrial. So in males, what is the tumor that I told you? Testicular tumor. What variety of testicular tumor? Particularly again, teratoma. So how many T's did you have? TTT. You say, wow, man, good thing. TTT. So testicular tumor. What type of testicular tumor? Teratomas. No, teratomas are not called now. They are called as NSGCTs, or what variant? They are again choriocarcinomas or embryonal cell cancers. But these are again theoretical ticks. What is important is in males, okay, let me draw the male, okay, right. Now, so for the males, it is testicular tumor and females choriocarcinoma. If you are poked further in males, anything more, yes, maybe a prostate cancer, rarely. And rarest of all, in both males and females, you have soft tissue sarcomas. Particularly remember an particularly remember a synovial cell sarcoma to make the list. So I've told you a long list. Okay. What is the first thing that I told you? I took a time, renal cell cancer. What is the second thing that I told you? In males, testicular tumor. What is the next thing beyond testes? Prostate. Women don't have prostate. Now, choriocarcinomas, endometrial carcinomas. If you are poked further, synovial. Majority of your MCQs are onto that. So the final words are, the mnemonic to remember this is, now people say like this, okay, maybe, well, I was taught by my teachers like this, and hence I teach it like this. The T in this is testes, okay. The P is prostate. The UB is urinary bladder, okay. Some people bring B as bones like osteosarcomas and synovial sarcomas. L stands for lung, that means bronchial cancers can go. Liver cancers rarely. I stands for intestine. The most common one again comes from colon and stomach. The K, obviously, is the kidney. So if you want to take a snapshot, please do, because the class is going to end now in minutes. So this is all about the surgical x-rays, the part 1 about a chest x-ray. So the T public thing is, the T is the testes, the P is prostate, U is urinary bladder, L is lung, liver, I is intestine, colon, and this. So this is all about something called as a cannonball metastasis. Now, before I end up and before I wind up for today, I've told you majority of these x-rays, etc. Just give me a minute. Yeah.
Ramanuj, we've been asked what is a subxiphoid window.
We'll be answering that. The next day, when the part 2 of the radiology will be a marriage between a chest x-ray and an abdominal radiology. This image that you can see is an airway, breathing, circulation, etc. ABCDE. Now the A is air, the B is bones. Now, can you notice that there is something wrong in this picture? And this one is all about the D thing. So that means if this is the diaphragm of the D, what is so special about the diaphragm? I taught you this one. So this kind of a air is thus below the diaphragm is called as free gas or free air, you may say gas, under the diaphragm. And believe me, is the most common MBBS X-ray. So the next class, the part 2, when you talk about surgical X-rays, will be this one, followed by other X-rays of the abdomen. I took this because for only one simple reason, because the next class when we will be having, so this is something that Dr. Sanjay Debakshi, Dr. Rudrajit Sinha, and I will be discussing with you, and then we'll be discussing something called peptic perforations and peritonitis to be talked about. We did not discuss about chest drains today because in instrument class, we'll be talking again with chest traumas and chest drain. Now, coming on to the question that I have been asked about on pericardial tamponade and subxiphoid window. Now, subxiphoid window means, let me take up this picture. Yes, this one. No, subxiphoid window means that if you do an ultrasound, now, if you do an ultrasound, remember, is all about a sound wave. Now, when you talk about a sound wave emanates from a U-shaped thing called as a probe. So this thing that I'm trying to make is called as a probe. And what it does is that it gives you a section-like thing. So this is called as a sector in mathematics. Now, so that means out of the whole picture, you did not get the whole picture. You got a part of the picture, and that part of the picture is one area, and thus this area will be in the radiology term called as a window. You did not get the full picture, but now if you place, if this is the xiphoid cartilage, this is the heart, and now if you place the probe down here, remember, you are getting a section that looks like again a triangle. So it is very good that you have got interested in that, because in the next class then I will be definitely taking a picture of that, and in this one, believe me, you will get to see the pericardium, the P, and you will also get to see the heart, which will be like this, and you will get to see the chambers of the heart also. And normally remember the pericardium and the heart are always stuck up like this. But if there is something in between the heart and the pericardium, what is very easily going to happen is the pericardium is going to get displaced like this, and instead of that, you are going to see some little amount of blood in that. So that will suggest you that you have a blood in the pericardium. Now, out of the whole picture, have you understood why is it called as a window? Sanjay, have I made myself clear?
Yes,
hello?
Ramanuj, I think it's very clear. And if you can provide them a picture next time, it'll be clear.
Right. So it will be definitely, I'll be trying to provide even a video even, because it is so dynamic. Right.